Good morning, everybody. Welcome to the 26th Emerging Growth Conference. I'm Anna Berry, and I'll be your host today. As always, we have an exciting list of companies in a wide range of growth sectors presenting to you today. All of our conferences are uploaded to the Emerging Growth Conference YouTube channel. So subscribe at our YouTube. It's youtube.com/Emerging Growth Conference. And just a few notes for those attending. Today, we're running until about 2:30 p.m. Eastern Time. So when we switch to the next company, you'll see a black screen for a brief moment, but don't go anywhere. It's just us moving over to the next presenter. But if you do experience downtime for more than a minute or two, just refresh your browser and it'll work again. Our platform does work best on Google Chrome. So if you're watching from an Apple device, you have to hit the play button to start the session. Now, during each company's presentation, you, our viewer, can submit questions through the webcast module, and the presenters may attempt to address as many of these as possible at the end of their presentation. One last note. After today's event, you'll be redirected to the registration page for the next conference. So please stay on or come back to reserve your spot early. So today we have 5 companies presenting. So without further ado, I'll introduce our first. We have SANUWAVE Health, Inc., trades on the OTC under the symbol SNWV, and is focused on the research, development, and commercialization of its patented energy-first, non-invasive, and biological response-activating medical systems for the repair and regeneration of skin, musculoskeletal tissue, and vascular structures. Please welcome its CEO, Kevin Richardson, and Chief Revenue Officer, Jack Schwetweg. Welcome, gentlemen.
Great. Thank you very much, Anna. Appreciate it.
All right. We look forward to hearing about this.
Great. Can everyone hear me okay?
Yep.
Yes. All right. So we'll be presenting about SANUWAVE, and we'll finish up with some Q&A at the end. My name is Kevin Richardson. I'm the CEO. We are SANUWAVE, a wound care technologies company. We trade on the OTC pink sheets as SNWV is the ticker symbol. We do have to put the obligatory forward-looking statement out, which you can review. Here are some data about the company, recent share price, shares outstanding, inside ownership. We are a wound healing company. We use energy products, which we'll describe to you in a moment, UltraMist and dermaPACE, to help the body heal itself. We're believers in that the body can heal itself when activated mechanically through energy products like UltraMist and dermaPACE. We have extremely effective devices. They're easy to use, and they happen to have nice reimbursement profiles for those customers that use it. We also have over 150 patents. We're in over 1,000 locations, both domestically and internationally. For those who aren't aware of the wound care market, it is a large and unfortunately growing market. Wound care impacts millions of lives. If I dive into the diabetic foot ulcer specifically, our health insurance, Medicare, Medicaid spend over $15 billion a year helping treat wounds and trying to get them to heal. A lot of diabetics have this occur because of the poor circulation associated with diabetes, and that's unfortunately an epidemic that's continuing to grow, and there's no sign in sight that it's going to abate. Where we serve these customers are in wound care centers, physicians' offices, skilled nursing facilities, and assisted living facilities as well. For those who don't know what a wound looks like, unfortunately, I'm going to share this one really gnarly picture, but this is what we live every day. We see wounds like this coming into wound centers on a daily basis, and our products help them heal, both on with the dermaPACE for diabetic foot ulcers and UltraMist for all types of wounds. We were going to share even more pictures, but we were told it was actually too gruesome, so we pulled those out. If you want to look at more studies, you can visit our website, go to the science section, and you can see lots of photos, lots of pictures of what we can do. Let me tell you about how what a typical wound goes through. The normal wound, where you cut yourself, that's considered acute. Those are wounds that'll heal in 4 weeks, and that's where a lot of the smaller wounds occur. With the chronic wounds, those are ones where they last for a really, really nasty long time. And from our standpoint, that's where we come into play. So we end up treating those wounds, in the advanced category. That's after 4 weeks of being treated. The competitors landscape are treating with hyperbaric chambers, treating with negative pressure wound therapy, or extracellular matrices. It's a large market. Our goal is to use our products and then allow the wound specialist to combine other products to close the wound. So that's the spectrum. That's where we serve. You saw the pictures before, the before and afters. That's really the market we're in. So let me move on to our products. The first product's dermaPACE. dermaPACE is an FDA-approved device for treating diabetic foot ulcers. Internationally, it treats all the different types of wounds. The way it works is the dermaPACE creates an energy pulse, a shock wave, an electrohydraulic focused energy pulse that goes into the body. And effectively, if you can picture a sponge, it squeezes the sponge and then stretches the sponge. That's what it's doing at the cellular level. It's causing a micro trauma at the cellular level. That sends off a mechanism of action, signals for growth factors, for perfusion, blood flow to come and help the wound heal itself. And that's really what the shockwave therapy does. Depending on the size of the wound, the depth of the wound, we can use either more intense or less intense therapy on that wound. It can treat, again, anything that's over 4 weeks old. And that's just so that it can get reimbursed. On the reimbursement side of the equation, reimbursement is very nice for this. Our business model is to sell the capital equipment, and then we sell wound kits, and we refurbish that little applicator head that you can see at the top every 60 patients. We'll move on to UltraMist. UltraMist is an FDA-approved device for all different types of indication of wounds, and has been around for a few years. So clinically has, thousands upon thousands of studies that have been done in patients that have been treated. It's in close to 1,000 locations currently, and is used really as a front-end way of treating these wounds. The way it works, it's, again, energy comes from the console, is put out through the wand, and delivered in a mist. So it's an ultrasound wave that goes into the wound, and that helps kill bacteria. It helps get rid of biofilm, which is where bacteria grows. It helps get the wound's vascularization improving so that it can heal. And it attracts collagen growth and other ways to allow that wound to heal faster. Very easy to use, 5 to 6 minutes per treatment. So it works within the workflow of a wound care center and a practitioner. Typical is 3 times a week, could be 2 times a week. They can do up to 12, sometimes 16 treatments to get a wound healed. And the main thing with both products is that they move the wound in the right direction by using the different forms of energy, shockwave and ultrasound. When we walk into a customer, we go through the value proposition that they get. And ultimately, we'll get to the return on investment that they're going to get as well. But it has superior clinical evidence where we both products can heal a wound to complete closure faster than other modalities of treatment. It's easy to use. It's kind of fun to use. You're kind of holding a little gun, the wand, and then on the other, it's the applicator. 5 to 10 minute treatment time, so it fits within the workflow of the office, which is extremely important. There's one office that was mentioning they didn't want to use it at first because they see 18,000 patient visits a year, and how could we ever fit this in? And now they live and die by it. So it's a good example of it can fit anywhere. Patient compliance is a problem in the wound care industry. A lot of these patients don't follow the rules, the doctor's orders. With ours, they just have to show up. They show up and get treated, they go home, and then they come back a week later to get treated again. The reimbursement is really nice, and that's why the ROI on the center is extremely high. The ROIs that a center is getting are in the high 50s to 100% a year. And there's very few, if any, wound care devices that are out there, wound care treatments that are out there that offer the same economics that we do in the wound care center. We have a great team supporting it. We're building a strong base of business and have a good international footprint. We're going to move over now into our growth strategies and our path forward, and I'll hand that over to Jack to take it from here.
Yeah, that's perfect. Thank you, Kevin, and thank you, everyone, for having us today. But, you know, when Kevin was talking about it, I think that the things that are very important to mention are our technologies, the Energy First platform, are not only great for the patients, but it's also great for the doctors. And that's something that we've kind of implemented into our growth strategy, knowing that it's going to be a center of profit and also healing for each of our clinicians. So when we look at the growth strategy moving forward, we have multiple different ways that we're going to do it. The cross-selling opportunities that we have. I mean, we have, you know, 2 different modalities, and, you know, you can argue that in every single one of those settings, both products could be used. So using our current sales force and our current customer base and being to expand those out, you know, the utilization of Energy First. We've also spent a lot of time in 2021 and now moving into 22, looking at the new call point opportunities that we have. We've seen tremendous success in skilled nursing, which has been an untouched market, assisted living, and the reimbursement in the physician offices as well as the wound care centers have you know, really kind of skyrocketed, and it's really driving a lot of the growth that you're going to see later on in the presentation. The most important thing I think, you know, you'll see is our feet on the street, right? Our footprint with our reps. So we're looking to add more W-2s, more 1099 representatives over the next, you know, 12 months to really kind of boost up that revenue that you're going to see. And each rep that we look at somewhere around roughly $1 million worth of revenue, you know, give or take, in certain areas. So we're going through an exercise right now to find those areas where, you know, they're a home run. Expanding reimbursement is a huge deal for us. Right now, we are covered across the country for Medicare. We have some great studies that have come out, so we're going to be able to go after those commercial payers, which alone will give a 40% increase in kind of in the business that we have now. Expanding the indications for dermaPACE. Right now, it's diabetic foot ulcer. We've seen from our international partners, you know, venous leg ulcers, and it be used in different areas. We now need to make that a reality in the United States, and we have the team for it. We have a strong R&D pipeline. We're constantly working with our customers to figure out how to make it better, whether it be for mobile use, whether it be for inpatient. It's just how we do that. And our international team is expanding very rapidly. And, you know, over the last year, also adding on UltraMist to a lot of those contracts where it was primarily dermaPACE prior to 2020. And then, you know, obviously, and I know Kevin's going to talk about it, a little bit on other markets, other things besides wound care, which we've seen a ton of interest in, have some pre-orders in some of those sections. So it all looks extremely positive and moving upward.
Great. So I'll talk briefly about the new verticals that we'll be entering. And just to echo back to Jack's comments, our market share within the number of treatments we could do within wound care relative to the size of the wound care market is still around 1, maybe 2%. So we haven't even tapped the wound care opportunity. The opportunity there could be to grow, you know, to multiple hundreds of millions of dollars, $300 to $400 million a year from our current base of 15. So we have a lot of growth in wound care, but as we've seen interest grow from a lot of folks, we've expanded into using the devices in other areas, orthopedic and cosmetic. Those will be generating revenue this year, actually already are generating revenue this year. Those are markets where we use the profile device for the orthopedic. So it's treating muscle injuries, ligaments, tendons, bone growth. It's all of those type of injuries that are treated by a chiropractor or in a PT office. On the cosmetic side with the shockwave, they can also treat scars in a form of liposuction as well, type of treatment. And then The big one is going to be Ultramist in the med spa market. It's a huge market, and we found through working with some of the top leaders in the plastic and dermatology space, the benefits of using Ultramist in that setting. It helps with collagen growth, vascularization, reduces rosacea, can clear up acne. The list goes on and on, but where we've found it most effective is they're using it after laser peels and microneedling procedures where there may be some biofilm that could risk those treatments. And since Ultramist can get rid of the biofilm, it helps with that healing process. And I guess on the laser peel side specifically, post laser peel, they're treating the patients now with Ultramist. It's causing first the pain factor to go down dramatically, and then the time to recovery is cut in half, because before they'd kind of be out of commission for a good week or so, and now with Ultramist, they're able to be back to normal and have everything feeling better and not as much pain and much faster. So we think there's a large opportunity. There is another competitor out there, uses a different type of product, but ours is, I'll call it better, faster, easier to use, more effective. And that competitor has an $800 million market cap. So I'm hoping that we can garner a similar growth aspect. On the cardiac side, we have a lot of patents in the cardiac space. Now that the Shockwave is being proved out in cardiac, we've been approached by a number of large international players and domestic players about setting up a joint venture, licensing, royalties, or venture capital development. And we're exploring those currently. We'll have something probably in the next quarter or two to announce on that should be pretty substantive. We're bringing on science advisors and board members from the cardiac space that will be really guiding us on how we go to market with this. And if it means we have to, get into some legal battles, we may do that as well. In either case, we're not going to put any capital out. We're going to find partners to address this large upside. I'll turn it back to Jack with my favorite slide. He gets that one.
There you go. That's all that matters. So SANUWAVE, we've seen significant growth over the last years, and some of the things that have been really exciting, and that what we know that we're onto something. We know the Energy First is working. This is kind of how we review the metrics, and we know kind of where we're going. And I think these are some of the highlights. System sale opportunities. So when we define an opportunity, what we look at is not just a simple lead. This is someone who has an interest in the Energy First. So they've heard something about it. There's been some sort of positive, opportunity that they've called us, and they're just in that pre-trial phase. So as you can see, the numbers are up 171% year over year in just the system sales opportunities. Now the number of system trials. Now that is our lifeblood, right? So we look at that in between 60 and 90 days. We offer a trial out to any of our clinicians because we want them to look at it financially and also clinically to make sure that it makes sense for their practice. Well, last year at this time, we had 17 systems on trial. Right now, we're sitting at 85, which is a 400% increase. Now, the system trial revenue is something that we really focused on, I think, somewhere around last May period. So we were, just under $500,000 of system trial revenue value, and right now we're looking at, a 695% growth over last year. The reoccurring revenue is something that is incredibly important because, as Kevin talked about initially, we do sell the systems, but the most important thing is those applicators. And once the doctors are done with the trials or the clinicians are done with the trials and they purchase that unit, the biggest thing for them is to now continue to reorder those applicators, to be able to treat the patients. So last year at this point in time, our reoccurring revenue was just under $500,000, and right now we're at $1.2 million, which is a 200% increase from last year. And you can see the numbers annualized to where we are, and right now that's a $13.7 million, a 200% increase. Our international forecast, with adding the new products and constantly going after new areas and new kind of ventures, we're gonna double that this year. So there's a lot of positivity that you see there. And the only thing that has decreased with all this positive kind of momentum that we have going forward is our number of W-2 salespeople. We've actually cut those in half, and we're looking now specifically for reps that will focus on that energy first, that have those relationships in the long-term care, the wound care centers. Those are going to be the ones that make an impact immediately and are going to get us, $1 million a rep, which is where we'd like to get to. And the good, sorry, I know it's not on here, but the other thing is that none of this takes into account our 30 1099 or distributor selling agents that we have. We're going to have more visibility on that, in the coming kind of months. But they are a significant part of our business. They're not mentioned here. So, Kevin, I'll turn it back over to you.
Great. And just to conclude, we'll wrap up with the investment highlights and get to Q&A. It's a big market, large opportunity. We've just scratched the surface on wound care. We're protected by patents that extend 150 that are on average expiring sometime around 2030. And we always are adding to those patent portfolios. The reimbursement environment is extremely positive. Ultramist has seen their reimbursement quadruple over the last 5 years. And so the docs are making a lot of money using these products. You can see we're cheaper less expensive than the other advanced wound care modalities. So we're saving the system money, making the doctors more, and getting the patients healed faster. We're partnering with a lot of the other companies that are out there. That's one of the things we're pushing on, is really bringing together a family that we can sell. I'll mention, the high recurring revenue, over 55%, high incremental margins. The final thing is this year, because of demand for our product, because of the positive reimbursement environment, we've implemented a 10% price increase. Now, this is to offset an increase on some of our costs, but that's an incremental margin on the price increase of 85%. So 85% of those dollars will be flowing to the bottom line. We encourage everyone to reach out if they have questions. Please contact either Jack or myself. Please go to the website. It's nice to finally be back at talking to investors. We were effectively dark for about 9 months as we had some SEC issues in our filings, and now we're all caught up as of Monday night. And let's bring on the Q&A.
Great. Thank you, gentlemen. Okay, let's jump right into it. Well, we do have a question about that from Tracy Silva. What happened and why were you taken off the OTC for a while?
Good question. When we acquired the Ultramist assets, SANUWAVE bit off more than we could chew. We did an integration, and we did it actually really lousy. And so our accounting systems didn't work the way they were supposed to. We went from 2 accounting platforms to a brand new one. And due to that, we could not get our filings completed on time with the SEC. When that happened, September 28th of 2021, the SEC moved us to the OTC gray markets. That's a mandate that was set out by FINRA and the SEC to do that. As of yesterday, we are now back on the OTC and trading. So it set us back, but that's behind us now. So that's the story.
Great. So does that answer Carrie Ortiz's question about, are the problems with the accounting platform behind you?
They are. We're still catching up. There's still some things that I would say we want to enhance to drive the benefits of the accounting platform. We have it's like having an expensive car, and we've just gone from first, now we're in second. And so we know we're moving and we're going in the right direction, but we aren't getting the full benefits of the system yet. And so that'll be what happens this year. But as far as just the block and tackle accounting, that's behind us. The processes are fixed, and we're looking forward to be on time going forward. Okay.
Abe Marsh wants you to talk a little bit more about your new verticals. How much will it cost to enter?
So I'll talk, Jack, I'll let you talk cosmetic and I'll talk orthopedic. And I'll go orthopedic first. There's 70,000 chiropractors. There's roughly 700 that are using energy products right now to help their patients. There are tons of PT facilities. So our target market is extensive. And we have what I would call the high-end product in Profile, which is a focused electroshockwave therapy device. We're using distributors to help on that. So we're going to get a lower gross margin, but we're not going to incur the cost of a sales team. So it won't cost us anything to enter that market. Cosmetic, I'll let Jack take.
Yeah, I mean, cosmetic, it's the same principle that we're using. The resources we have right now in marketing and in sales, and then also science, we're leveraging them a little bit, for the cosmetic. But we partnered up with a couple of key opinion leaders. We partnered up with some distributors. It's going to be a distributor model in which, the key opinion leaders are going to really drive that marketing that we're going to create. But we're going to be able to see revenue come in with very little expense. We're not trying to build out a new sales force for it. We're just trying to, utilize our product in a different way that the market so badly needs. I mean, just the response that we've gotten over a soft launch of it over the last couple of months has been, pretty drastic. So we're very excited about it. But also at the same time, wound is our focus. And that's where we're going to be spending our money.
And Jack, I'll just add, Jack's tagline that he's rolled out is "Looking beautiful doesn't have to hurt," and it's really resonating with the med spa world in the customers. So it's we're excited about the mist taking over.
That's great. We don't have a lot of time, but I want to end on a positive note, and we have a lot of questions surrounding that. Sal Scott asks, how do you see the Energy First platform revolutionizing wound care? And we're going to tie in Oscar Henderson's question, what excites you about the Energy First platform? You can close with that.
Sure. The body's a wonderful thing. And the body knows how to heal itself. It's when you're sick, it knows how to take care of things. And all we're doing is using mechanical stimulation through energy to help the body fix itself. And a lot of times these are because the body has been compromised. In a diabetic patient, their microcirculation is compromised. They can't get the blood flow needed to the wound to heal the wound. And so that's really the thesis around this is that, sometimes pharmaceuticals are important and they're to heal something, but using the body to heal itself, that's really what the ultrasound and shockwave both do. And where we see it fitting in and why the tagline is Energy First is specifically that. We use it, think of it as a jumper cable. A wound is stalled out. It's not getting any better. The doctor doesn't know what to do. He applies Ultramist or he applies dermaPACE, and it gets that wound moving in the right direction. So we view ourselves as that precursor to potentially other therapies where they can combine it. And a lot of the clinical work we're undertaking currently is on combinations. How to use energy with other products to really change that landscape of wound care. And our goal is, no diabetic foot ulcer should be amputated. It's a horrible outcome. And our goal is to get enough devices out there, Ultramist and dermaPACE, that never happens again.
Wow, we've come so far with technology. Thank you, gentlemen, for this great technology you're providing for people. It's so important right now. So please join us again in the future. Give us some updates, and we look forward to hearing your presentation again. Thank you for your time.
Thank you very much. Bye-bye.
Bye.
All right, everyone. What a great day we have coming up. More presenting. So stay with us as we transition to the next presenter. We'll be coming right back.